afternoon, and we hope everyone here is in good health. And may Allah make it easy for anyone afflicted in any way. Allahumma ameen. My name is Brother Abdullahi. I am the Outreach Director of Noble Health Home Care located in Falls Church, Virginia. I'm here today with my two co-founders, one named also Abdullahi and also Brother Muhammad. Our topic today is home care during COVID and beyond. We are glad to be giving this talk today because all, if not most people, know someone that can benefit from our service or from this service. Our goal, inshallah, is simplify the home care process with correct information and empower everyone to navigate through it with ease. At the end, if anyone has questions or answers, we can go through a Q&A session. Brother Abdullahi will now start us off with why someone should consider home care in the first place.
Thank you, Abdullahi. Assalamu alaikum. My name is Abdullah. I'm the account manager at Noble Health. And inshallah, today I'm going to be talking about why home care was the best care option during the COVID pandemic and why it'll continue to be after. So as most of us are aware, the hardest hit demographic during the pandemic were the elderly, disproportionately. And the elderly are the number one beneficiaries of long-term care. And what we mean by long-term care is care given to somebody or an individual who can't provide care for themselves for an extended period of time. And this can be many things like meal prep, if they can't clean for themselves or if they need help taking their medication. And this comes in many forms. Long-term care comes in many forms, like rehab centers, nursing centers, retirement homes, and home care as well. So one of the main reasons why home care was the best option during the pandemic was that it allowed people receiving care to social distance and isolate themselves. So they weren't susceptible to spreads and infections. While in the other facilities that provide long-term care, they weren't able to do this easily. That's why if you go state by state, you'll notice that the majority of the deaths that occurred from the coronavirus pandemic were in these specific facilities, like retirement centers and rehab centers. And the state that we live and operate in, Northern Virginia, more than half the people who died were in these types of facilities. And this leads to my other point is that with home care, it's very robust. If the individual needs a change in care, or if they need something else to be done for them, changes can be made very easily and quickly. It's very adaptable. While in these other facilities, it's very hard to make a change for a specific client because it might affect the care of other clients. So most of the time they take the facility into account more than they do their patients. Another reason why home care is a great option is that you get care from the comfort of your own home, around your family and your loved ones, not around strangers. And as Muslims, we all love our parents and we want to be with our elderly ones as much as we can. We don't want to have to jump through hoops and sometimes even drive far places just to see them. Also with home care, it's very personalized. When a person is admitted into home care, a nurse will come out, do an assessment, and see exactly what the person needs and make a plan tailor-made to them. It's not a one-size-fits-all approach. And in my opinion, the biggest factor with home care and the biggest plus is that the family gets to choose who the caregiver is for their loved one, as opposed to these other places where most of the time you have no idea who's taking care of your loved one. And sometimes it's multiple people, multiple shifts, and most of the time it's a revolving door. And as Muslims, we also want our parents to get the best care as possible, and we want to have a relationship with the person taking care of them. Inshallah, Brother Muhammad is going to talk about now how to cover the cost of home care.
Thank you, Brother Abdullah. I appreciate that. Assalamu alaikum, everyone. My name is Brother Muhammad, and I'm the operations manager, and I handle the day-to-day operations. I'll be covering two topics today. The first topic is covering the cost, and the second is how to apply. Now, when it comes to home care, there are one or two options. The first is Medicaid, and the other option is out-of-pocket expenses. For Medicaid, if eligible, I will discuss further in the next slide, in the how to apply slide. So depending on what county you live in the Northern Virginia area, whether it's Fairfax, Alexandria City, Loudoun, Prince William, and so on, the first initial thing to do when applying for Medicaid is reach out to your local social worker. The social worker's job is to initially set up initial assessment and determine if you're medically and financially eligible. After 30 to 45 days or so, you receive a letter in the mail from the county stating whether you have been approved or not. If approved, the next further thing to do is to apply for the EDC waiver, and that's the Elderly and Disabled Medicaid waiver. And that is the same process as calling the social worker. This one is a little bit different. The case manager will determine whether you meet the requirements. Now, the caseworker does an assessment, and she meets if you can apply for personal care, and you go on and so on from there. This process is 30 to 45 days. If approved or not, you receive a letter. Same scenario. If approved and you receive the letter, the next thing is choosing an agency, a certified home care agency that maybe is recommended to you by someone you know, or someone you trust and you've been working with for a long time. After choosing an agency, you choose an insurance company. There are 6 insurance companies in the state of Virginia that usually work with Medicaid directly. The next thing you do from there would be typically we'll send you over a caregiver after you've been approved for everything, alhamdulillah. And Brother Abdullah will discuss that further.
Thank you, Mohammed. As he mentioned, I will be discussing taking care of your loved ones and what that can mean for you. Brother Abdullah mentioned this earlier, but in our own experience and the feedback we get from the public and from our own Muslim community, many folks don't see home care as a practical solution for them because A, they don't like having a stranger in their home, and B, they don't feel comfortable with them being the primary caregiver for their relative. And for quite a while, that was the case. If you wanted home care services, an agency would have to send a nurse to your home and they'll be that caregiver, right? So it could be a different ethnicity, different religion. A lot of times that feels very uncomfortable. However, now anyone could be the caregiver for their own relative, even while living with them. In other words, you can be the caregiver and be the one getting paid to do the things that you already may be doing, which is taking care of your parent, your sibling, your relative, your child. Again, it does not matter if the two of you are in the same address. The only thing that matters is that you first become a certified caregiver. And to do that in Virginia, you must fulfill the following requirements. First, you must be or get TB tested. Second thing is you must complete a CPR certification. Now, this is about a 2-hour course. And if you need to do one, any agency can help you find one locally, or if you already have a CPR certification, you could just bring that with you. Third, you need to complete a home health aide certification. Now, this is about a 40-hour course. So Monday through Friday, right, 5 days. And at the end, you have to pass an exam. If you complete the TB test, the CPR certification, and home health aide, you can get started today and get paid. So all in all, I know this is very new information for everybody here. So we created a form that has contact information where you put your first name, last name, your email address, and your number. Any questions or comments that you want to ask us, we'll give you a call back. We'll give you all the support you need. So please feel free to fill that form out and get back to us. In the next slide, you have our information for our contact, our address, and our email. And that is all for today. Inshallah, we hope to hear from you guys soon.